5-Minute Pearls for Clinical Practice. This week's pearl is create handouts for your patients. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. This week, I would like to discuss something very important in clinical practice, but it is something that few clinicians actually do. It's something that I learned about during my first few years in practice, and I have expanded this over the years, and it is something that I encourage students and young physicians to do. It also applies to health professionals in other fields. Years ago, when I started working with patients, I had so much information that I wanted to get across to them. I wanted to tell them about nutrition. I wanted to tell them about exercise. I wanted to make sure that their medications and their medical problems were optimized. Early in practice, we usually have more time to spend with patients. However, as time goes by, we get busier and busier, and all of a sudden, I found that I had much less time to spend with patients. And I found that I didn't have the time to get to all the important patient education matters that I wanted to. So I started to create patient education handouts. Slowly but surely, I would put them together, and back in those days, I would give them out as pieces of paper. Nowadays, everything is electronic, so such handouts can be digitalized and sent to patients. But handouts on topics that come up in practice, such as nutritional topics, sleep topics, exercise topics, or any other educational topic specific to your specialty can be very important for patients. For me, the issues came down to high cholesterol problems, high blood pressure problems, and issues like that. I started slowly with just a few handouts, and before I knew it, I had dozens of handouts that I kept in folders in my exam rooms, and I would give them to patients whenever appropriate. As medical information changed, I would edit the handouts to keep them updated and fresh and current, and I found that my patients really appreciated that these handouts were written by me and were personalized. They weren't just some standard handout that I printed up off of the internet. My patients started to give these handouts to their friends and their family members, and it became actually a very nice way to connect with people. Sometimes I would get phone calls from friends of patients of mine just to thank me because they read some of my handouts and they found them useful. It became an important way for me to educate patients and also a way to affect patient behavior between visits, as patients would sometimes put their handouts on the refrigerator door or bedside table. And to take that one step further, what I would often do with the handouts is when I gave them to patients, I would circle the 1 or 2 or 3 different things that I would want that person to work on until the next office visit. I found this process incredibly rewarding as I saw firsthand how helpful this was to patients. So I encourage young healthcare providers to think about creating educational handouts specific to your specialty and or areas of interest, and to take the time early on in your career to work on them and to flesh them out and to make them something that's personalized to you, your style, and your interests. These types of handouts can add immeasurably to your practice and to the quality of healthcare that you provide your patients. And maintaining these handouts is not very difficult. Usually it just takes a little bit of editing over time, and then you can consider sharing your handouts with other healthcare providers, perhaps in your practice or in your facility. Some practices create practice-wide handouts, and that could be something you can look into as well. There are a lot of ways to implement this idea, but think about how you might try your hand at this. The handouts can be brief or detailed, whatever is more appropriate, whatever is best for your patients and for your practice. The goal is how best to serve your patients and their healthcare needs. But think about how patient educational handouts can be integrated into your practice, and think about how you can create patient education handouts that would work in your practice. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice. You can email me at drmorris@5minutemd.com. That's DRMORRIS at 5minutemd.com. You can post your comments and your experiences on the 5 Minute MD Facebook page. You can follow us on Twitter at Brian Morris MD. And you can visit us anytime on our website, 5minutemd.com. Let your friends and your colleagues know about the podcast and make sure that you are subscribed on iTunes. When you are subscribed on iTunes, you will receive new podcast pearls as soon as they are posted. And if you have a few minutes and you enjoy what we're doing here on this podcast, please head over to iTunes and leave us a review. Thank you so much for listening. I will see you at the next 5.